Hi, my name is Tetsu Tanaka. I'm a research fellow at University Hospital Bonn in Germany. And thank you so much for this opportunity to introduce our paper about acute kidney injury following tricuspid transcatheter H2H repair. And in this study, we investigated the incidence of acute kidney injury after transcatheter H2H repair for tricuspid regurgitation and its association with clinical outcomes after the procedure. This study was a retrospective study using the data from the registries at 2 German centers, and this study included 268 patients who underwent transcatheter H2H repair for tricuspid regurgitation. We defined AKI according to the JACC criteria, and the primary endpoint was a composite of all-cause mortality and rehospitalization within 1 year after the procedure. And in this population, acute kidney injury was occurred at 15.7% of the patients, and we assessed the predictors for acute kidney injury in this population, and we found that age, male sex, GFR at baseline of less than 60 were independently associated with the incidence of acute kidney injury after the procedure. And furthermore, patients with procedural success had a lower incidence of acute kidney injury compared to those without procedural success. And the incidence of acute kidney injury was associated with a higher incidence of the composite outcome within 1 year after the procedure. And our Kaplan-Meier curve shows that the impact of acute kidney injury was not only limited in 30 days, but also consistent from 30 days to 1 year. Moreover, we found that the post-procedure increase in serum creatinine within 7 days after the procedure had a linear correlation to the risk of the composite outcome. Our finding highlights that the AKI can occur even after H2H repair for tricuspid regurgitation despite the absence of contrast agent use. And the incidence of acute kidney injury was also associated with a poorer prognosis after the procedure. And also our findings may assist in identifying a high-risk patient for acute kidney injury after H2H repair for tricuspid regurgitation. Thank you so much.